Hello everyone, welcome to MBBS Atlas. In today's video, we'll be discussing about axillary artery. Axillary artery is mostly asked as an SAQ in our exams, and in this video, we'll be talking about the parts of the axillary artery, the branches of axillary artery, as well as the relations of axillary artery. So, as you all know, the relations of axillary artery are a bit tough or a bit confusing, but let us try to understand the relations in an easy way. So, first, axillary artery is the continuation of subclavian artery. Okay, so this is the basic intro line. So, axillary artery is the continuation of subclavian artery. Now, what is the extent of the axillary artery? Axillary artery is extended from the outer border of first rib to lower border of teres major muscles. Now, what is this outer border, lower border? We'll try to understand. So, this is the first rib, right? This first rib, it has two borders. This is the inner border as well as this is the outer border. So axillary artery starts from the outer border of first rib. Okay, now till where it extends? It extends to the lower border of the teres major muscle. So this is the teres major muscle. It has two borders. This is the upper border as well as this is the lower border. So axillary artery extends till here to the lower border of teres major muscle. So what can we write? The axillary artery extension is from outer border of first rib to lower border of teres major muscle. Okay, now what are the parts? What are the parts of this axillary artery? This axillary artery throughout the course, throughout its extent, it crosses the pectoralis major muscle. So during this crossing of pectoralis major muscle, axillary artery is divided into three parts: the first part, the second part, as well as the third part. The first part is proximal to the muscle. The second part is beneath the muscle, whereas the third part is distal to the muscle. Okay, so pectoralis major is the main pectoralis minor is the main muscle which divides the axillary artery into three parts. So the first part is superior or proximal to the muscle, this one. Next, the second part is posterior or deep to muscle, this one. And the third part is inferior or distal to muscle, this one. Okay, so these are the three main parts of axillary artery. Now, each of the part gives its branches. So there are some branches coming out of the first part, there are some branches coming out of the second part, and as well as there are some branches coming out from the third part. Now, we'll be looking at these branches. Now, branches of axillary artery. Now, what are the branches of the first part of axillary artery? First part of axillary artery gives a branch called as superior thoracic artery. I'll use another color. So this is the superior thoracic artery from the first part of the axillary artery. Now, the second part, which is posterior or beneath to the pectoralis minor, it gives two branches. One is thoracoacromial trunk, and the second one is the lateral thoracic artery. So these are the two branches from the second part. Remember, from the first part there is only one branch, second part two branches, third part three branches. Okay, easy to remember, right? So first part we have only one branch, superior thoracic artery. From the second branch we have two branches, thoracoacromial trunk as well as the lateral thoracic artery. Whereas from the third part we have three branches, those are subscapular artery, the anterior circumflex humeral artery, as well as the posterior circumflex humeral artery. Okay, so when there is a fracture of humerus at the neck, there is a damage to this anterior circumflex humeral artery. So this is also one important point to be considered. I hope you are clear with the branches. I have represented in atlas diagram also. If you want, you can draw this type, or else you can also draw this type in the exam. It's up to you. Now, let us come to the main part, the relations of axillary artery. So axillary artery, we have discussed the parts. Those are three parts, right? So first part has separate relations, second part has separate relations, as well as the third part also has a separate relations. Okay, now what does these relations include? These relations include mainly muscles and the cords of brachial plexus. These are the two main the two main things to remember. So relations include mainly the relations of brachial plexus as well as the muscles. Now, what I suggest you guys is, please remember the relations like this only. don't try to make mnemonics, because in exam it will become tough. So I know remembering the relations of this axillary artery is a little bit tough, but with practice and revision, with 3 or 4 revisions with diagram practice, we'll be getting the relations easily. So please do practice them after this video also. Now let us look at the first part of the axillary artery. Now relations are discussed under 4 headings: anterior, posterior, lateral and medial. Okay, now what are the anterior relations of the first part of axillary artery? So those are skin, superficial fascia, deep fascia, pectoralis major muscle, and loop of communication between medial and lateral pectoral nerves. Okay, when we look at this diagram, you can see there is pectoralis major muscle. Even you can represent skin, superficial fascia, deep fascia here. So this is the pectoralis major muscle, and you can see there is a loop connecting between these two nerves. What are these now two nerves? From the lateral side, there is emerging of lateral pectoral nerve. From the medial side, there is emerging of medial pectoral nerve, and there is a loop connection between these two nerves, and this forms the anterior relation of the first part of axillary artery. I hope you are clear. So what are the anterior relations? Skin, superficial fascia, deep fascia. These three are the common anterior relations for all the parts of axillary artery. You can write blindly these 3 parts: skin, superficial fascia, deep fascia are the 3 common parts for the all parts of axillary artery for anterior relations. Okay, so skin, superficial fascia, deep fascia, pectoralis major, loop of communication between medial and lateral pectoral nerves. Now what are the relations of posterior side? Posterior side, we have medial cord of brachial plexus and nerve to serratus anterior and serratus anterior muscle, and we have first intercostal space. Okay, so these are the this is the posterior side, right? So this is the medial cord, long thoracic nerve or nerve to serratus anterior and serratus anterior muscle, and here we have first intercostal space. These are the posterior relations. Now what are the lateral relations? Laterally, we have lateral and posterior cord. Okay, so lateral cord as well as posterior cord. Now what are the medial? Even for the medial relation is also same for every part, that is axillary vein. Anterior relations is same for all the parts, that is skin, superficial fascia, deep fascia, and medial relation is also same for every part, that is axillary vein. Okay, now let us dive into the relations of second part of axillary artery. Second part of axillary artery, first we'll be looking at the anterior. As discussed earlier, we have skin, superficial fascia, deep fascia. Along with this, we have pectoralis major and pectoralis minor. See, we have pectoralis major muscle, I have pectoralis minor muscle in the anterior relations. Whereas in the posterior relations, we have posterior cord of brachial plexus and subscapularis muscle. Now in the anterior relations, where was the posterior cord? It was in the lateral relations. So now in the second part, it is in the posterior relations. So please understand this difference, don't get confused. In the second part, posterior cord is a posterior relation, whereas in the first part, this posterior cord is a lateral relation. So you need to be a little bit careful here and take some time to understand all these things. Okay, now let us see the other relations. The lateral relations. Lateral relations is the lateral cord of brachial plexus. See, this is the lateral cord of brachial plexus along with the two muscles, coracobrachialis and short head of biceps brachii. So these are the lateral relations. Now medial relations, as discussed, axillary vein is the common for all the parts. Along with axillary vein, we have in the second part is medial pectoral nerve and medial cord. Remembering the second part relations is somewhat easy, because in the posterior relation we have posterior cord, in the lateral relation we have lateral cord, in the medial relation we have medial cord. So remembering the second part relations is somewhat easy. Now the relations of third part. In the third part, we are going to discuss about two relations, from the upper part and from the lower part. So third part is again divided into the upper part as well as the lower part. First we'll be looking at the relations of upper part. Now anterior relations, skin, superficial fascia, deep fascia. Along with this, we have pectoralis major, and we also have medial root of median nerve. When we were studying brachial plexus, we saw that median nerve, it has two roots, right? One is the medial root from the medial nerve, and another one is the lateral root. So here in the upper part we have medial root of median nerve as a relation in the anterior part. Okay, in the anteriorly we have pectoralis major as well as medial root of median nerve. Now in the posterior part we have radial nerve, axillary nerve and subscapularis muscle. Okay, in the posterior part we have radial nerve, axillary nerve and subscapularis muscle. In the lateral part we have lateral root of median nerve, coracobrachialis, the short head of biceps brachii, as well as the musculocutaneous nerve. So these are the lateral relations. When we come to medial relations, medially we have medial cutaneous nerve of arm, medial cutaneous nerve of forearm and ulnar nerve along with axillary vein. Okay, I know these relations are a little bit tough to remember, but practice along with the diagram. Watch the video if you did not understand it, and if you have any doubts please do comment, and practice the diagrams for it. Diagrams are the main key. See, second part is somewhat easy because like posterior relations we have posterior cord, lateral we have lateral cord, medial we have medial cord, but it's not in the case of first part as in the third part. Okay, so you need a lot of practice for this. Next, the lower part relations of the third part, right? Third part we have upper part, lower part. Upper part we have discussed. Now we'll be talking about the lower part. In the lower part, anteriorly we have skin, superficial fascia, deep fascia. In the posterior we have the radial nerve, the latissimus dorsi muscle along with teres major muscle. Okay, now in the lateral side we have median nerve, coracobrachialis along with short head of biceps. Now in the medial part we have medial cutaneous nerve of arm and forearm along with ulnar nerve and axillary vein. See, the relations of upper part and lower part are somewhat similar, so it is also somewhat easy. So all I want you guys to do is just practice these diagrams and these relations for 2 to 3 times. It will be registered in your mind clearly. Okay, and last but not the least we'll be looking at the clinical anatomy of the axillary artery. First, axillary artery is used for pulse palpitation. Now which part of axillary artery the pulse we can feel? From the third part. So from third part of axillary artery can be palpated in the axilla by pressing it against the humerus. This pulsation site is useful in upper limb injuries. So if there any case of amputation of upper limb, if the doctor wants to feel the pulsation, so he can palpate the axillary artery palpations in the axilla. Now aneurysm. What is aneurysm? It is the abnormal dilatation of an artery. Suppose think this as an artery. This is the normal artery. When we call the artery has aneurysm when it has abnormal dilatation like this. So this is the case of aneurysm. So what happens in this aneurysm, in the axillary artery aneurysm, is there will be compression of brachial plexus leading to pain in axilla, numbness and tingling down the arm and weakness of the limbs. So this is about the axillary artery. If you have any doubts, please do comment in the comment section, and don't forget us to follow on Instagram and Telegram, and please do like, share and subscribe. Thank you for watching.